Thank you so much for joining us. I'm Ashley Evans, and we are sitting here at Dia Forum with advocate Thuli Madonsela, who'll be speaking to us about innovation in healthcare in Africa. Thuli, thank you so much for joining us.
Thank you, Ashley, for the privilege.
So where is Africa going in terms of healthcare, and what do you think is needed for us to get there?
I believe Africa is trying to improve its healthcare system and generally trying to improve its population well-being, and all of this is guided by the Sustainable Development Goals, and it's also guided by Agenda 2063, which is a continental vision on where the continent will be by 2063 on all fronts, but particularly on the issue of health. And then different countries also have their own strategic plans. South Africa, for example, has the National Development Plan. And in all of this, I see some improvements on some fronts. For example, insofar as Africa is leveraging technology and disruptive innovations to improve diagnostics and to improve access to health care. However, there are still problems. We've heard from the panelists this morning and some of the speakers that Africa is still lagging behind when it comes to the universality of access, and also the ability to prevent what is preventable, and the ability to detect what, if detected early, could be cured fast, more efficiently in terms of the use of resources, and more effectively in terms of success rate in the use of whatever therapies that will be used.
So early detection is obviously something that's very important in this case. What are we doing in order to ensure that detection rather than treatment is taking place?
Well, it will appear to me that based on the panel that we heard this morning, a lot that is being done. Roche itself is part of those that are expanding the frontiers of access, frontiers of early detection. And then we've heard also from the panel this morning that there are attempts at personalized health care. Then there is something that South Africa is doing and some of the countries under the AU are doing, which is creating a national health system or national health insurance to better fund access to healthcare, including technologies for detection and better treatment.
And in South Africa?
Well, in South Africa, we have the National Development Plan that is guiding everything we're doing, which is about total health and well-being. So not just focusing on health, focusing on nutrition as well. For example, you will know that the First Lady has launched a plan that is looking at nutrition for the little ones. We currently have about 28,000, I understand, 280,000 young people that are growing with deformed brains simply because of lack of nutrition. So that's being taken care of. The Minister of Health has a national health insurance strategy, which is about bringing everyone on board to advance health care. There has been a bit of resistance, and primarily because people are concerned about maladministration, waste of state resources, and corruption being partly the cause of why the health system is not coping with challenges of access, particularly universal access, and also broadening the availability of health technologies and therapies. However, from the University of Stellenbosch, we do think that even if government was operating properly, you still wouldn't have enough of all that needs to be done to reduce inequality, poverty, and in that process also universalize health care. And we're busy with something that is called an M Plan for Social Justice. It's partly about helping government using research from the academic world to use data more effectively to plan better. So leverage data analytics to plan for inclusive policies, and those policies could be in healthcare, and certainly healthcare is one of the priority areas. It could be education, it could be ITC, and etc. We're also looking at leveraging some of the goodwill in society to collect funding that will fund strategic areas that will be prioritized. to improve equality and to reduce poverty. And all of this will be guided, or is being guided, by Sustainable Development Goals. And if we could invest in something that advances more than one Sustainable Development Goals, that becomes a priority.
I suppose an interesting look at it would be that funding obviously limits development, but in the same sense, our development also limits our funding.
Well, certainly, and I think that's one of the points that was raised this morning by the professor from Wits University, our very last speaker. She did raise the point about funding and how do you make the right choice between this advanced technology that we're talking about that is anchored in personalized healthcare, whilst at the same time we have limited funding that should universalize healthcare. Personally, though, I think it's not a choice between this and that. Personalized healthcare is something that we need to look into, even if we are looking at grouping groups and saying we are going to look at health patterns by this particular group so that we can design even preventative strategies to help that particular group insofar as total well-being is concerned.
Absolutely. And do you think that enough is being done in terms of innovation in Africa in the healthcare sector?
Personally, I don't think so. I think there is some innovation. As you saw in my slide this morning, I think there was a time when there was a lot of innovation. The fact that we're the first people to have a heart transplant and other things. But currently, there is some innovation. For example, in apps to universalize access. And some of the information that we heard this morning is also about using disruptive technologies to be more responsive to individual persons or to specific groups. But it would appear that a lot of it is coming from other countries and collaborating with us, but I'm not sure whether we have adequate staff that is homegrown.
Now let's talk about Diaforum. Yes. Tell me about the event and the importance and significance of such an event.
The Diaforum is a marvelous opportunity for those who are involved in healthcare, particularly in so far as the use of technology and innovation to solve healthcare challenges. Come together, share ideas, share insights, and maybe find room for collaboration. And we've heard the discussions this morning, and I could see from the body language of people that there were aha moments. And I suspect what's going to happen is that during lunch tables, people are going to talk to each other, and it's going to spark new ideas in terms of new developments that people could do. But more importantly, it creates opportunities for collaboration.
And Roche Diagnostics is doing quite a lot on the continent to bring Africa into health prosperity.
I think that is a great thing. Well, firstly, health can be a means to prosperity in that health is a business. It's about providing value to society and getting paid for providing that value. And that's the best way to earn income and wealth. But also, health is an important issue of wealth, is an important issue of the economy, because without health, everything falls apart. And if we're looking at pushing all of the other sustainable development goals, we will need a healthy nation, mentally healthy, physically healthy, nutritionally healthy nation that can be able to focus on all of the other development areas.
The theme of Diaforum is Africa is changing, where to from here. What are your sentiments on this, and what is your vision for healthcare in Africa?
Well, Africa is changing, and where to is a good question, because it can change in a progressive way, but it can also change in a non-progressive way. And one of the problems that Africa needs to look at is defining where it wants to go, diagnosing its broader problems, health and otherwise, and making sure that it enters into collaborative partnerships that advances predetermined goals. I have seen, I travel around the continent, I've seen a lot of collaboration, for example, with China, without singling China, but with China, where you feel that you are actually a piece of a puzzle in someone else's design, but you haven't predetermined what do you want to achieve from these relationships yourself. But having said all of that, I have noticed from the Roche diagnostics approach that it is really about sharing ideas, sharing insights, sharing technology, and building bridges for possible collaboration. And that's what I would like to see. What is my vision for Africa? Of course, it's a vision that brings 2063 closer. I don't think we have enough time to sort out health if we're waiting for the perfect Africa to arrive in 2063. I think we have to focus on the next 11 years, which is the Sustainable Development Goals. And I think we need to focus on the health of women, particularly prevention of preventable diseases. We need to make sure also that Africa is brought forward insofar as awareness of some of the new diseases, or at least relatively newly known diseases that can debilitate people. And yet, if diagnosed early, I spoke earlier about scoliosis, that if diagnosed early, it could be corrected, but a lot of people don't know about those things. And I'm hoping that an opportunity such as today will spark ideas around Africa collaborating but also inventing to make sure that we earn wealth from health initiatives, and also we have health initiatives that are responsive to the different circumstances of our continent.
Fantastic. Well, thank you so much for your time.
It's been a privilege. Thank you.